Yes, we'll get back.
This is the Ideas Bulletin, live ideas from the field, from the COVID-19 Peer Hub. We have with us on the line, and we're trying again to connect with Dorothy. Dorothy, can you hear us?
Dorothy? I'm hearing you.
Okay, great. So could you introduce yourself, please?
Yes. Pardon?
Please introduce yourself.
I do it. The introduction.
Yes, please introduce yourself again. We've had some connection issues, and so we want to try again. Please introduce yourself.
Okay. Hello.
Yes, we're listening to you, Dorothy. Could you tell us who you are and what you do and where you work?
I'm Dorothy. I'm Dorothy Logedi. I'm a nurse. I'm working at Awendo Sub-County. I'm coordinating immunization activity. Awendo Sub-County is one of the sub-county in Migori County. Migori County is one of the counties in Kenya.
Okay, I'm here with Charlotte.
Are you hearing me?
Yes, loud and clear. So I'm here with Charlotte Mbu. Charlotte is going to ask you the next questions. Charlotte?
Dorothy, after going through the COVID-19 Peer Hub for 6 weeks, what has been the most remarkable experience that you are going to carry with yourself?
What I've carried out from the peer hub, one, from the engine, the materials which was presented was really remarkable on improving my immunization activities in the Awendo sub-county, because most of them were just based on how to improve immunization activity. Then another one is from the peer hub, or from the experience I've gained. A project will be called a project if it is implemented. That is what I've learned from the peer hub.
Great. Thank you, Dorothy. Right. We're receiving you loud and clear. Charlotte, back to you for the next question.
Thank you, Reda. That's very well said, Dorothy, that a project is a project only when it's been implemented. So what was a specific challenge that you were facing in terms of immunization within the context of COVID-19, and what goal have you set in order to meet that challenge?
So my specific challenge was low uptake of PV, and this had been contributed to very few mothers coming for deliveries at the health facility. So most of the PV we always get when the mothers come for delivery, so the mother gets the PV before they are discharged home. So in the COVID-19 context, the mothers are not coming to come and deliver at the hospital as before. Hello?
Yes, we are getting you. Please go ahead. Please go ahead, Dorothy. We are getting you.
Okay, the mothers are not coming to the facility to deliver there. So we are missing this PV, because when they deliver at home, they again delay to come for the PV. So it has made the PV being the utilization has dropped. That is why I decided, so that I may take that as my major challenge. We may see how we can do so that we improve the PV in my sub-county. So what are the steps I've taken or the goal now to work on? I've said we are going to work with the CHVs, community volunteer. Then we are going to work with the TBA, traditional birth attendants, because traditional mother attendants is where all these mothers are going. And when they go there, they're not coming back for the battle PV. So when we work together with this, we map them, then we work together with them such that we put the TBS attached to the CHV, and we make a log so that they can be tracked until they're delivered, until the children has gotten the battle PV and subsequent immunization. Hello?
Thank you, Dorothy.
Yes,
So
Dorothy,
we are here with Dorothy
Dorothy.
Lojedi from Kenya. Dorothy is a nurse who's been participating since the 27th of July in the COVID-19 Peer Hub organized by the Geneva Learning Foundation and working with global and country partners. Charlotte Mbu is hosting this event. You can see her picture on screen. And Charlotte has more questions for Dorothy. I then have a few of my own. Thank you, Dorothy. I'm glad we were able to connect. Some of you may have joined earlier. We had technical difficulties, and that happens because we are connecting with people who are on the front lines of the pandemic, on the front line of where children are vaccinated and protected from vaccine preventable diseases. Charlotte, back to you for the next questions.
Very much, Reda. And for those who are just joining, Dorothy said her goal is to ensure that all children get the OPV, the oral polio vaccine at birth. So, Dorothy, can you tell us again more actions, concrete actions that you intend to take to ensure that all of these children actually get their vaccines?
So, first was a mapping of the mothers with the CHVs, then the TABS, then still the healthcare workers. They are going to be trained. Already some have been trained on safety measures for both mothers and the healthcare workers, because if they are not trained, the mothers will still fear to come to the facility because they are thinking of going to get COVID-19. The healthcare workers are going to be trained. Again, routine immunization is going to be, as usual, strengthened in that we may not have missed opportunity, because if we don't do daily immunization, these children can come to the facility and still they miss the battle PV. So those who have been delivered at home, sorry, and managed to come within the 2 weeks, they should get OPV staff doing immunization daily. Also, as EPI coordinator, I should make sure immunization OPV is in stock, meaning I should do forecasting as it is so that I may not have shortage of battle PV. It should be in the store so that if the children come, they should get the immunization.
All right.
Hello?
Thank you. Thank you, Dorothy. We got you very well. And I just want to ask, is this plan in line with the ministry, with your ministry's EPI plan? How is your plan in line with the ministry's EPI plan, the Kenyan Ministry of Health?
So with this one, I think with this, it is because in the ministry we do micro planning. And in the micro planning, we include the immunization and how immunization it is included with the forecasting, how to get also in the community, how the community should do the referral. Hello?
Okay. Yes, thank you, Dorothy. I have one last question for you before handing over to Reda. I just wanted to find out, how can the Peer Hub help you in the coming weeks to implement, to make sure that these actions are actually implemented for you to reach your goal?
You know, before the Peer Hub, we were just planning just randomly. But when I just started being in a Peer Hub, it is specific. You have something to do specific, and it is something which is going to have an impact on what you are doing. Am
right,
I answered your question?
Yes, Dorothy, thank you very much for answering my questions. And I saw that you used a lot of ideas from the ideas engine when you were drawing up your action plan.
Yes, because in the peer hub, if I can now clarify, it was a mixture of doctors, consultants. So the ideas which are there is a concrete ideas which you can use to improve what you are doing. Hello?
Okay. Yes, Dorothy, thank you very much for answering my questions. I think my list of questions is quite exhausted for now. So Reda, over to you. I'm sure there are comments on Facebook that I've not seen.
Yes, so there's quite a few. So Rebecca Scholastica Bello-Bobo says, glad I met up with the session. And some of you are joining us again because you joined the first time when we were having technical difficulties. That's normal and healthy to have technical difficulties. Thank you, Dorothy Lojedi from Kenya, for your persistence. We're finally able to hear your story. So I have heard you and Charlotte discuss very seriously how you have gone about the work. I have a different kind of question. By working in the Peer Hub, Dorothy, have you made any friends whether from Kenya or from other countries? Have you gotten to know participants, fellow immunization staff who are working every day to keep immunization going during the pandemic? Did you make friends in the last 6 weeks?
In the last 6 weeks, I made friends. I have this Kanisa working from Nigeria who is doing M&E. Was my coffee, remote coffee. Also, I've been in touch with the Martha. Martha has helped me very much since the Teach to Reach. We are still in touch with the Martha. So I've made friends through the Peer Hub.
Yes. Okay, that's wonderful to hear. Thank you. And we are getting you loud and clear. So we made it. I'm especially glad when we overcome technical difficulties together. Thank you so much, Dorothy. So to recap, the Peer Hub has 3 components, the ideas engine. So Dorothy told us how she was able to tap into the collective wisdom of more than 3,900 immunization staff from 96 countries. Second, Dorothy persisted for 4 weeks developing an action plan in line with her Ministry of Health's plans and directives, but really focused on her local reality through the Peer Hub Exercise 1. And third, starting on the 21st of September, we will be kicking off the Impact Accelerator, in which that action planning, we will work together in friendship, in comradeship, in collaboration to take these action plans and turn them into concrete actions. Last but not least, we will be focusing in Exercise 2 on communication, negotiation, and community engagement. So that will be starting on the 2nd of November. Now we are going to be opening the COVID-19 Peer Hub for second round through the call of applications. And I see the first question here from Francis Ibama. So let me stop talking and read Francis's question. Francis wants to know, Dorothy, how did you deal with the issue of funding to ensure your plan is implemented? Because funding is a major problem in this part of the world. Have you, with respect to the activities and the actions you want to take, do they require funding? And if so, how are you approaching this question?
About funding, it is still a challenge, but because we have some partners who are supporting immunization activities, I was making a proposal to them so that they can assist me and implement my project. Hello?
Yes. Thank you, Dorothy. Georgios Milios, I believe from Greece, unless I'm mistaken. Georgios, please correct me if I'm wrong, says, thank you for being part of the effort. It is really a great curse and the way it is materialized. I think that sentence may not be complete, but thank you, Georgios. We get the point. Thank you, Dorothy. So as you know, the headlines have been about the consequences of the coronavirus in North America and Western Europe. As an immunization worker, you may have been involved in epidemic response in the past for measles or for other vaccine preventable diseases. What is new or different, Dorothy, for you about this pandemic? What has changed for you in the last few months that surprised you that you did not expect?
So what has really surprised me with this pandemic, the COVID-19 pandemic, it has a lot of stigma than other outbreaks. Because from the look, in my country, if just sneezing, coughing, people run away from you. That is why, even when they said stay away, don't come to the facility, mothers thought it is even worse, or they have relieved them from walking. So with this pandemic, it has stigma, more stigma than any other outbreak. And yes, it was something new. It is something new. People don't know how, because you can't know who has and who is not having. So with this pandemic, the stigma is high than any other infections.
Yeah. Understood, Dorothy.
And also with the following the directive, it made everything worse, because from the directive stay at home, it made, now even if you go to the mothers, they just still feel stay at home. And when you go to the facility, to the community to do the immunization, you get the mothers coming for immunization.
So one final question for you, Dorothy. Can you think of a time when you spoke with a caregiver, probably a mother, and can you tell us what were the words you used to reassure her about the safety of bringing her children for vaccination, as well as the safety of the vaccines themselves? So
First of all, I explained to the mother the importance of immunization. When the child gets immunization, the child is immune from many infections. So if the child gets immunization, even COVID infection will not be strong, or it will not put the child down, because already there is immunity. Then second, I explained to the mother, we take care of the child, the mother, and also the nurse. So when she comes to the facility, she will be having a mask, to put on a mask. Also, the healthcare worker is putting on the mask, washing of hands, will wash hands, so that, because contamination of COVID-19 is more on the surface. So you wash hands, the healthcare worker protects herself and also the client, because he's going to put on the mask. So they should not be worried when they come to the facility. All protocol will be observed, distancing, and also washing of hands, and also sharing of objects like thermometer will be sanitized before the client is going to use it.
Thank
Hello?
you. Yes, thank you, Dorothy Lojedi from Kenya. Thank you so much for joining us and for your persistence in sorting the issues, the technical issues that prevented us from connecting with you the first time. Rajat Garg from India has another question for you. He asks, do you have any experience where someone came to an immunization session and was then infected with coronavirus? Do you have that experience, Dorothy? Or we hope you have not, but what is the situation where you work as a nurse in Kenya?
So far, a client coming to the facility and getting infection with the coronavirus, not yet in my sub-county. But what might have happened, a staff who was corona positive, not from immunization department, was from PSC department, but because of the rumors, it made the facility, it remained without a client because of hearing, oh, a staff has COVID-19 positive. But as a mother getting contracted with COVID-19 in Awendo sub-county, no.
Understood. Okay. We'd love to hear from Rajat Garg if he has had that experience in his work. All right. Any other questions from you, Charlotte, before we close today's live ideas? And I'm glad we made it.
No questions from my end. Rather, I just want to thank Dorothy for actually hanging on with us till the end and for all the effort that she put in, and first and foremost for accepting our invitation today.
Great. Thank you so much to Dorothy, to the folks who are following us on our Facebook page, Digital Scholar. We're also on YouTube and LinkedIn, so please find us there and do share. If you found this firsthand testimony of what is happening, what is changing with the pandemic for immunization staff from all levels, from the health facility to the capital city, join us. This is One Daily Bulletin. We'll be doing this every day or nearly every day, at least 3 times a week, Tuesday to Thursday. So if you miss the live, you can still come in and share, look at the recording and leave your comments and questions. We read everything you write. Thank you so much. One correction is that there is no evidence to my knowledge of vaccines reinforcing protection of COVID. COVID is not yet a vaccine preventable disease. Just wanted to clarify that. Thank you so much. Take care. We look forward to, we'll see you tomorrow. For those of you who have joined us today, you can come back or you can find the recording at your leisure. Take care.